Did you know your overall health depends on a microscopic layer most people have never heard of? The glycocalyx? Welcome to the future of vascular health. Healthy Vessels, Healthy Future, the podcast dedicated to uncovering the hidden science behind vibrant health, longevity, and vitality. Brought to you by the GlycoCheck Research Institute, each episode delivers cutting-edge insights into microvascular health, empowering you to finally understand why you might be experiencing fatigue, brain fog, or poor circulation, even when your labs seem normal. Through actionable advice and expert interviews, you'll learn how protecting your glycocalyx can significantly improve circulation, support your heart, enhance brain function, and prevent serious vascular issues before they begin. Tune in weekly and discover how healthy vessels today create a healthier, brighter future tomorrow.
Hi, my name is Steve Adams. I'm with Genesis Health Sciences and the GlycoCheck Research Institute, and welcome to the Future Vascular Health podcast. And I'm excited today. We're going to meet with Dr. Scott Tauber to talk about an exciting new technology. It's not new technology, but I should not say, but it's an exciting technology called VMA. And Scott, welcome to the podcast.
Thank you. Appreciate it.
Yeah.
Good to be here.
You bet. And I didn't have your bio. So can you kind of just give a rundown on your bio a little bit so everybody understands, the weight of kind of who you are?
Yeah, sure. Absolutely. Well, my training is in chiropractic. I'm a chiropractor and I practiced for over 20 years. And during that time, saw a lot of PI patients and also started to get requests for doing consulting from local attorneys to help out some of my colleagues related to their PI practice, documentation, and those kinds of things within their cases. Over time, became a consultant to state regulatory agencies here in Arizona, also some of the major auto insurance carriers. I was a consultant for a while for them as well, and doing records reviews and depositions and testimony. Been a med legal expert as far as medical malpractice cases, and over time just basically focused in now on working with providers specifically on their PI practice. And that's kind of like the development of everything, is working with providers, helping them understand this med legal arena where none of us learn this in our professional training. And so a lot of providers come out of school or they practice with somebody and they think they're doing things right, and it's not really what it should be. So I help them with that. That's what I do.
That's really great. And PI, just for everybody, is personal injury work. You said attorney, so most people probably connected the dots, but I wanted to make sure we were clear. Yeah. That's great. And you live in Phoenix, Arizona area?
Yep. I'm here in Arizona. Yep.
Yeah. Tell us about what VMA technology is before we talk about how you got interested in it, so people can understand. Yeah.
Well, VMA stands for Vertebral Motion Analysis, and it's a technology that allows the providers to be able to see a patient's spine in motion from beginning to end. The motion that we're talking about is what's called flexion and extension. So flexion is where you're bending forward, chin to chest, or bending over at the waist, trying to touch your toes. Extension is bending back, looking up at the ceiling, and obviously bending backwards. When a patient does that, there's an opportunity to be able to see in real time if there's any sort of ligament injury. And so the VMA uses technology at a very high level to be able to identify if there's movement of the vertebrae because those ligaments have been overstretched. And it can't be detected with some of the more traditional, such as CT or MRI, and X-ray is very limited in what it can do because we're actually basically watching a movie instead of looking at two photographs. So that's what the technology is.
Right, it's live. Yeah, and I went through it in Oklahoma City area in the last few months, and it was fascinating to see for me, I've never had a car accident or anything like that, and so everything proved fine. But I wanted to know because I played football all the way through 4 years of college, and so I wanted to see, did
Mhm.
I have some long-term permanent damage from all of those collisions?
Yeah.
So it was nice to know that it wasn't. How long has this been? Or no, let me ask you this first. What got you interested in it as a provider yourself?
Sure. Well, this has been something that's been on my radar for a really long time. Part of what I do is in working with providers, I work with them individually, but I also do seminars and have my own consulting programs and company. But part of what I do is train doctors to be able to get better at personal injury. So within that, there's a ligament injury, spinal ligament instability. So I've been advocating for this, identifying this injury for many, many years.
Hmm.
When the VMA technology crossed my desk, I got really excited because there's nothing out there like this. There's similar,
Yep.
there's X-ray and there's other, but there's nothing that hits all or checks all of the boxes like VMA. So whenever you compare it to, and I get this all the time, doctors try to compare it, okay, to this or to that or to that,
Yep.
and it's either way off or even if it's similar, it's still not to the level of what VMA can
Sure.
identify and produce. Yeah.
Yeah. Okay. Great. And how long has this been available, Scott?
It's been available for probably about 13 or 14 years.
Yep.
And originally, just to give the listeners just a little background, it's been out there for a while, but and it was created, interestingly enough, by spinal surgeons to be able to identify this particular injury that we're talking about, spinal ligament instability or pathology, at a high level, because all they had prior to this technology was your standard X-ray, which are
Right.
very inaccurate for a lot of different reasons, which I can go into if you want, but they're just they're just
Yeah.
a little inaccurate. And so before the surgeon was going to either do surgery or prepare for the right surgery, they needed the highest level of information, which is a good thing if you're a patient, right? You want your surgeon to have all the information
Yeah. Right.
before
Exactly.
you don't want them guessing. So
Right.
they created this technology. What they didn't see is the broader application in personal injury cases, in sports injury cases, and in chronic neck and lower back pain patients who maybe have had X-ray, maybe have had treatment, maybe have had MRIs, multiple MRIs, and just haven't really found what is the cause of their pain. So it's not just a PI technology, and it's not just for somebody who's considering surgery. There's a broader application of
Yeah.
this technology.
Yeah. With chronic pain, right, and
Mhm.
identifying the source of it, because
Mhm.
that. I mean, I don't need to tie this back to glycocalyx, but I will tell you that one of the biggest things that impacts the health of that organ is stress.
Mhm.
And when somebody's chronically in pain, they are stressed. Like
Oh yeah.
it is an ongoing, never-ending systemic stress. So yeah, that's fascinating. We both know about one organization called In Control Imaging that you and I
Mhm.
both know. How do you see someone like that integrating it into their practice, or a regular DC bringing it into their practice? Maybe both ways.
Sure. Well, if you're a regular provider, you just have your own office and VMA technology is available in your area, I would highly recommend that you use this as part of your plan of care and your
Yep.
diagnostics and your workup, especially in personal injury cases, but with patients that are also chronic as well. So
Yeah.
there's a sweet spot in there for personal injury, like when to do this, because obviously personal injury is a trauma-based event. And so,
Yep.
part of that is being able to capture the objective findings sooner rather than later. If somebody's
Sure.
chronic, they failed treatment, they failed diagnostics, you can run this right away on day 1 or 2 of your treatment plan with this to identify this injury, and especially if when they're chronic, they've already had x-rays, and there's a very high percentage that they've had also MRIs. And then why are they still, as a provider, you have to start thinking, why are they chronic? Why wasn't the pain generator identified? So this is a perfect opportunity.
Right. And to the extent a provider doesn't have it, they're unable to get that definitive diagnostic. Right. It really is handicapping their ability. Right. And then how about it in an imaging center like what we're seeing with like In Control?
In Control, In Control is a way for providers to be able to refer in to a facility.
Yep.
So if if you don't have this in your office, or you don't necessarily want to bring this into your own facility, if you don't have the space, or the setup is just not right for you, you can refer out to facilities like In Control Imaging, and they'll go ahead, run the test for you, just like you would write a script for an MRI. You just write a script, and they take care of everything, and they go ahead and run the test, get you the reports back, and then you can make clinical decisions from there.
It's like timeshare, right? It's a shared service kind of deal with all of the, exactly.
Yeah, if you're a provider, it's just like an imaging center. So you send for an MRI to an imaging center, you would send to In Control. They have this technology, and they'll run the tests for you.
Yeah. Scott, you see people, I'm trying to think how to express this. My guess is there's a lot of people who get into fender benders, and they kind of shake it off, and they say they're okay. And it doesn't take much to create a real problem, does it?
No, it doesn't. And that's one of the misconceptions, is that there's a direct link between the amount of speed or property damage or impact and the amount of patient injury. So even in low speeds, and you can get lost into the literature, and it's all documented in the literature, but the amount of speed or property damage has no direct correlation to whether a patient's going to be injured or not.
Wow.
And as a provider, you want as much information as possible when it comes to, when I work with my providers, I kind of dial it all the way back and go, listen, the underlying reason that patient is there today is because they had a trauma. They were involved in a trauma, and it involved their spine. You want as much information as possible, starting with, X-ray, VMA, understanding their injury. When you have more information as a doctor, your treatment is going to be better. You can focus in on what's causing the patient's pain. When your treatment is better, your outcomes are going to be better, and your patients are going to be happier. And so that's kind of bringing it all the way back on why providers should be doing this on PI. But some of the literature out there also states that more than a majority of patients, even after their motor vehicle crash, and even if they get treatment, will still be left with chronic pain within a few years. So if you are treating PI patients and that patient comes back, or if you're doing a history with a patient and you realize, okay, this patient has had, multiple motor vehicle crashes, there's a good chance they have this here. And if you're working with the spine, like say you're a chiropractor and you're working with the spine, you want to know if that spine is unstable before you do your procedures. So anyone working with the spine should really have as much information as possible about this injury.
So let's flip it. There's people listening to this podcast who may have been in something and shook it off, thought they were fine. What are some, symptoms that, warning signs, symptoms, things like that would cause somebody, maybe I should go get one of these tests. Maybe I should seek out the care of a chiropractor.
Sure. Yeah, that's a great question.
Did you know your overall health depends on a microscopic layer most people have never heard of? The glycocalyx? Welcome to the future of vascular health. Healthy vessels, healthy future. The podcast dedicated to uncovering the hidden science behind vibrant health, longevity, and vitality. Brought to you by the GlycoCheck Research Institute, each episode delivers cutting-edge insights into microvascular health, empowering you to finally understand why you might be experiencing fatigue, brain fog, or poor circulation, even when your labs seem normal. Through actionable advice and expert interviews, you'll learn how protecting your glycocalyx can significantly improve circulation, support your heart, enhance brain function, and prevent serious vascular issues before they begin. Tune in weekly and discover how healthy vessels today create a healthier, brighter future tomorrow. Are you feeling tired, foggy, or noticing poor circulation despite doing everything right? The answer might be hidden in your microvascular health. Introducing Revasca and Renew, two groundbreaking supplements scientifically designed to restore and protect your vascular foundation. Revasca revitalizes your circulation, supports heart health, and naturally boosts your energy by repairing your blood vessel lining, the glycocalyx. Renew complements this by providing deep cellular repair, resilience against stress, toxins, and inflammation, and enhancing your overall vitality. Together, Revasca and Renew offer the complete solution for lasting health from the inside out. Visit GlycoCheck.com today to learn more about how these powerful supplements can help you reclaim vibrant health and lasting energy. Thanks for listening to The Future of Vascular Health. Healthy vessels, healthy future. Ready to uncover what's really going on beneath the surface of your health? Take our quick Revasca quiz today. Discover how well your glycocalyx, the crucial microscopic lining of your blood vessels, is functioning. Revasca isn't just another supplement. It's a scientifically backed solution designed to naturally strengthen your vascular health from the inside out. Say goodbye to persistent fatigue, brain fog, and circulation issues. Say hello to lasting energy, clear thinking, and vibrant health. Go to www.revascaquiz.com now to take the Revasca quiz and start your journey toward better health today. Because protecting your glycocalyx means protecting your future.
You know, the symptoms of somebody that has a spinal ligament instability or injury are very similar to the most common symptoms that patients present with after the crash themselves.
Wow.
So the way I look at it and the way I talk to providers, your patients are going to come in and headaches and neck pain and muscle spasms and possibly lower back pain and tingling and numbness and maybe even muscle weakness. You know, a lot of those are the most common symptoms after a motor vehicle crash. Our job, so if you have those and you've been involved in a crash and you're thinking, well, do I have spinal ligament injury? Well, the only way to know is to get a VMA
Right.
at a high level. But, you know, if you're having that as a provider and you see that kind of soup of symptoms, your job is to differentiate where that neck pain or headaches are coming from. And it could be a multifactorial thing as well. It's not necessarily just spinal ligament. It could be, you know, a subluxation. It could be a simple sprain or a strain. It could be a disc, but it could also be a spinal ligament as well. And it could be all of them. So our job is to identify injuries, diagnose at a high level, and use the available technology, which is, you know, VMA.
If someone never had a trauma-related crash, but what kind of symptoms would they experience if they somehow, you know, caused this instability maybe some other way, like a sports accident or something like that?
Yeah, well, we haven't really touched on that, but, you know, sports, you mentioned football. I mean, a motor vehicle crash is a single incident. Football is like ongoing injury.
Yeah, oh, I know.
You know? I mean, but not even just starting with like, okay, when did you start? You start like 7, 8, 9, and maybe the forces aren't that great because, you know, the speed is not that great. But as you get into, you know, junior high and high school and college and professional, and not just games, but practice, and you think about the amount of traumas, right? Yeah. So,
they're micro traumas.
Absolutely. So there's ongoing traumas that can cause this injury. And so if you have something in your background, even like a slip and fall down the steps, you know, think about any trauma. I mean, you look at some of the football games, right now, and you see, maybe I look at it from a different perspective, but all I
As a
do is see,
chiropractor.
I see necks going in directions that they shouldn't. I see, all kinds of things happening out there. And yeah, the player shakes it off, but that doesn't mean that A, it didn't hurt, and B, they haven't caused any damage.
Right.
So,
Oh, I know. I remember a game where I was looking at the bottom of my foot because my leg turned like a pretzel and freaked me out, and I had a couple of stingers where I was paralyzed for 2 seconds and then I wasn't. Little mini ones, and I played in the 80s when they didn't have all the rules. So we used our face and the top of our heads to tackle people, and so I heard, I had read, well, I watched that movie called the Concussion movie, and if you played 10 years in the NFL, it was like 1 million car wrecks. And so I kind of liken it back to, well, if you played from 6 years old all the way to college, it's probably 250,000 car wrecks. Because the pros don't hit other than on Sunday. They don't hit during the week. And I grew up in an era where you played full on pads, full tackle, hitting 3 days a week during the season in practice. And so and I have a lot of friends who have a lot of problems with their backs and their necks, and I'm just fortunate I have none, like no problem anywhere.
You're very lucky. You're very lucky. You're the exception.
I know, and I'm 61. Years old.
There's a lot of research out there about the cumulative trauma and the life expectancy of NFL players. I mean, this takes a toll. It's a trade-off, obviously. It's their job and they're compensated well, but it does take a toll on their body.
Well, the larger point though is that someone's listening here. It's not just if you got an fender bender, you could have slipped in the parking lot or tripped over a chair in the house. There's all kind and what's funny with the people I've been around for many years, it's like it can be the smallest little, you were turning that just right and then fell and tweaked something, and that starts the whole cascade of events.
It doesn't take a lot. If you're, like you just said, if you're in the right position with the right force at the right, location, it doesn't take a lot to create an injury. I mean, we all think that, as I mentioned, you have to have a certain amount of impact and a certain amount of vehicle damage, or if it's a car crash, or it has to be this big event. It doesn't have to be. It could be those little micro injuries, microscopic injuries over time. What is it, like death by 1,000 cuts? Just a little. You get 1,000 cuts, and that's going to be the end of it. But you take 1,000 hits over time, you can create, ligament instability. You can create degeneration of the spine, disc issues, all kinds of conditions. And the other long-term effect of this is people are looking for a solution. Even people are out there self-medicating. They're tired of going to the doctor. It's like there's a large group of people that have pain and they've been to doctors and they don't want to go anymore because the doctor's at a loss, or the solution is not something that they want, whether it's medication, right? So they can't function, or it's surgery and they just don't want to get operated on. So people are looking for answers to why is this happening? Why am I not getting better? Why can nobody find this injury? And you even mentioned it earlier, chronic pain has a psychological component. Over time, people, it changes them when somebody's in chronic pain, and especially when there's no answer. I can't tell you how many times patients are just happy that somebody has told them what their problem is. They may not be happy that they have it, but at least they're going, okay, this is not just in my head. I'm not imagining it. There's a name to it. And now, okay, let's talk about doing something. But when you're suffering for months or years, I mean, it has an effect on you.
It does. I mean, I'm in the lifestyle medicine business separately. And when people can't sleep and they're stressed, you can't heal their body very well. Because there's second, third order effects that happen as a result of sleep deprivation. And, last time I checked, when my leg hurt all night, I didn't sleep.
Mhm.
And I can't imagine that over 5 years for my back, you know.
Mhm.
So, Scott, what I want to ask you now is the hopeful part is, okay, they go in, they get the VMA, they identify it's ligament-related spinal instability. Did I say that correct?
Yep, you did.
What's the opportunity now as the provider to bring them healing?
Sure. Well, like anything else, patients are appreciative that you've identified it, but at the end of the day, they want to get better, right? So,
Yep,
so,
right.
so what are the treatments associated with this? It depends on your scope of practice and it depends on your specialty. So we can start with chiropractic. As a chiropractor, you'd want to obviously not manipulate an area that's hypermobile. I mean, you can adjust above or below or other parts of the spine, but if you have the ability to do rehab or spinal strengthening exercises in your office, then that's something that you can do. Just to back up 1 second, is that because this is a ligamentous injury,
Yep.
the histology and the physiology of a ligament is they have a poor blood supply.
Okay.
So we have to, if we're going to heal this injury, we have to force blood into the ligament. If we can't force blood into the ligament to help healing, we have to strengthen the muscles around the joint.
Yep.
And so that's where the spinal stabilizing and strengthening exercises come in. If you're a medical provider, PRP, platelet-rich plasma, is an option. It's a little bit more invasive. You know,
Yep.
it's an injection of your own blood and own plasma in there, but that is one of the things that can be done. Physical therapists can do strengthening exercises, leading all the way up to, spinal surgery if the injury is bad enough. But
Yep.
that's not an option for everybody, and not everybody wants it. And that's sometimes a little on the extreme side. But some of these injuries that are still problematic and still cause symptoms, you can be very conservative and get great results. But like anything else, you have to identify what the injury
Yeah,
is.
right.
It's
The
coming
VMA
from
does
first.
that. Scott, when you said the histology of ligaments, and is that what you're talking about? The blood flow to the ligament has been compromised because of the injury, or they just are inherently blood poor?
Yeah, no, you're right. Ligaments are inherently blood poor.
All
So
right.
wherever that ligament is, whether it's in your spine, your
Yep.
ankle, your wrist.
Yep.
So if you break a bone, right, you fracture your leg,
Yep.
we know as providers, 6 to 8 weeks, it's going to be fine because bone has a really good blood supply.
Yep.
So that's how things heal. So we know we're good. With a ligament, we have no idea. We have no idea if it's
Yep.
going to
I've heard it
heal.
takes 6, 9 months. Yeah.
It may never. And in a lot of cases, this ligamentous injury is a forever injury. It is going to be a weak area of the spine. And that's why PRP is really good, because we can get down deep into the tissues. And if you don't opt for that, and your provider recommends strengthening exercises, you have to be consistent with those strengthening
Right.
exercises, because when you don't, it's going to allow that joint to move too much, right?
Yeah.
And
The
that's
muscle
gonna cause damage.
atrophies, it doesn't support, right?
Mhm.
So can the blood supply or flow in a ligament, can it be improved if you improve blood flow overall in the body, or is that just a static issue?
You can try. There's certain things that you can try to drive the blood in there, with
Yep.
the PRP and stem cell to a certain point. But yeah, you have to physically force the blood into a ligament. It just inherently has a very poor blood supply.
Got it. Okay. Because I know, like with the company we're talking about, I'm involved in, that is this podcast. We've got really good data documented. We can vastly improve blood supply throughout the whole body. But that's why I was kind of digging into that to see if that's
Yeah.
possible. And I think probably what you're saying is maybe a little bit, but it's still a positive thing to have the overall body improve blood flow.
Yeah, overall, and if you can isolate where that blood goes into that ligament, that will help speed it up.
Sure. Yeah. Yeah. Okay, good. All right. Well, we're going to finish up with this question, and then I know you want to give people a way to reach you. How do you see the role of VMA in the future of patient care and healthcare overall?
I just see it being more utilized in doctors' offices. You know, a lot of doctors, well, the typical, let me see, the typical way is patients come in, you take x-rays, and then over time, you'll do an MRI. And that's about the extent of the technology. MRI is very, cost effective. It's very accessible. VMA is going to be that way as well. MRI is a static test.
Yep.
But the other thing that if people are listening, whether you're a provider or just a layperson patient, an MRI is never going to find this injury. It's a static test. You're literally asked to lay there. And in order to identify this injury, you need a motion technology. You have to be able to move. And you're encouraged to lay as still as possible, especially in the higher level MRIs, because of the artifacts. So even breathing sometimes is an issue. But so MRI is not going to find this. And now you have an alternative and another way as a provider and a patient to get your symptoms evaluated or to help your patients at a much higher level. So it's going to be more widely utilized.
MRI has a lot of positives. It's just not, maybe it's a misapplied tool in this case. You have a better tool for
it's
what
not going to. The other cool thing about the VMA, and just quickly, is that it has the ability to not only identify the injury, but also to quantify it. We can literally measure down to the 0.5 millimeter how much movement there is, which is critical because if you're going to get treatment as a patient or you're going to recommend treatment, you can come back and redo that test and see if that ligament instability has improved. Where other technology just kind of gives you, well, yes, there's some ligament instability, it can't quantify it. X-ray has issues because the patient is free-form bending and it's just not as consistent and reliable as VMA. And those are the huge benefits for VMA. It's reliable, it's consistent, it's accurate, it's quantifiable. All of those things that none of the other technology out there can compare at this level.
How do people find you, Scott, if they're listening and they want to talk about maybe, it's going to be two people. There could be a provider listening because we have a lot of providers listening to this to get it into their clinic. And then there are other people who just want to get a test. So how do people find you to kind of get figured that out?
Yeah. Well, they can reach out to me directly. And in fact, if you send me an email to Dr. Scott, that's DRSCOTT, at drivingforcecompany.com, I'll be more than happy to send you a free resource that we have about the importance of identifying this injury in PI cases. And it comes from a former high-level auto insurance carrier executive, where we did an interview with them and they go into detail on why providers really need to look for this injury in their PI cases. And then of course, chronic cases as well, but PI is extremely important. So I'll be more than happy to share that and get that to you if you send me an email. And it's a great resource to have, and comes from a different perspective from the insurance carriers, which is a very cool perspective.
Yeah. So Dr. Scott at drivingforcecompany.com, and I'm sure our team will make sure that's in the notes really well. Scott, thank you for being on the podcast today.
Yeah. Well, thanks for having me. Appreciate it. Thank you, Steve.
Thanks for listening to The Future of Vascular Health. Healthy vessels, healthy future. Ready to uncover what's really going on beneath the surface of your health? Take our quick Revasca quiz today. Discover how well your glycocalyx, the crucial microscopic lining of your blood vessels, is functioning. Revasca isn't just another supplement. It's a scientifically backed solution designed to naturally strengthen your vascular health from the inside out. Say goodbye to persistent fatigue, brain fog, and circulation issues. Say hello to lasting energy, clear thinking, and vibrant health. Go to www.revascaquiz.com now to take the Revasca quiz and start your journey toward better health today. Because protecting your glycocalyx means protecting your future.